Good morning. Welcome to the plenary session 1. Due to the heat discussion in the previous sessions, we delayed the start of this plenary session by 15 minutes. For the sake of time, let us start the first presentation. This session will be co-chaired by Tae-guk Jun, Samsung Medical Center, Seoul in Korea. My name is Minoru No. I'm a professor at the University of Tokyo and Japan. First presentation is going to be by Dr. Yan Won Park, Korea. His presentation title is going to be Experience of Korean Heart Foundation in Medical Assistance Program for Developing Asian Country. Please start your presentation.
Thank you. I will be presenting today on behalf of the Korea Heart Foundation to share our experiences in supporting medical care in developing countries. South Korea, once one of the world's poorest nations, has made significant progress since the Korean War. In the past, our heart patients had to travel abroad, mainly to the United States, for surgery. However, since 1984, we have become self-sufficient and can now provide the necessary medical assistance locally. Our growing economy has enabled us to invite heart patients from developing countries to help them get surgery. I think it is important to understand these developments before moving forward. As a part of South Korea's reconstruction plan after Korean War, the United States supported the training of 70 professors at Seoul National University's medical school under the Minnesota Project. This initiative played a crucial role in improving healthcare conditions in South Korea. In March 1963, Dr. Young-Gyun Lee was one of the training doctors by Minnesota Project, and he successfully performed ASD closure with their help. It's fascinating to note that we are only a decade away from the world first by Dr. Gibbon. In November of that year, ASD closure was performed by Dr. Pil-Hun Hong, a certified cardiothoracic surgeon based in the United States. The equipment used during the procedure include a bubble oxygenator and a Sigma motor pump and operation record, which can be viewed. Till 1977, the number of congenital heart surgeries performed per year has not exceeded 50 cases due to the high cost involved in Severance Hospital. A heartwarming story involves Mrs. Harriet Hodges, the spouse of the executive director of the American Korean Foundation. She came to know about a Korean employee of the foundation whose child was suffering from heart disease. Mrs. Hodges conducted research and found out that during the Vietnam War, somebody had sent Vietnamese pediatric heart patients to the United States for surgery. She arranged for the child to be sent to Minnesota for the surgery. Since 1972, she has helped almost 3,000 Korean children get surgeries for about 30 years. Sister Michaela, a nurse at Medical Hospital in Busan, assists patients scheduled for surgery by taking them to Camp Hialeah, a United States military base in Busan, where they could be examined by military doctors. If patients decided to proceed with surgery, Sister Michaela requested Mrs. Hodges to arrange for the surgery to be performed in the United States. In 1970, South Korea was dedicated to New Village movement with the slogan, "Let us live well once," as a means of overcoming its long-standing poverty. The goal was to improve living standards and achieve prosperity. Many individuals who had studied in the United States were eager to return home and contribute to the country's development. South Korea's economic development was accelerated by this, leading to the inclusion of the OECD in 1996. From $4 billion in 1960, the country's gross national product surged to $1.8 trillion in 2021. It is 450 times bigger. The AATS has been a strong advocate of the current ASCBTS postgraduate course. In the past, AATS sponsored Graham Travelers Fellowship Program, which enabled renowned cardiothoracic surgeons from different parts of the globe to receive one-year training at various hospitals. In 1976, Professor Bum-Gu Cho underwent training at Boston Children, UAB, and Texas Heart Institute. His study of cardioplegics during this time greatly improved the result of challenging and risky heart surgeries in Korea. When Sister Michaela learned of his achievement, she began sending children with heart disease who had been sent to the United States to Professor Bum-Gu Cho in Seoul. Later on, the Byung-Chul Chang, a junior, also completed a fellowship. In 1983, US President Reagan visited South Korea and took 2 pediatric heart patients with him to the United States. This is Mrs. Hodges. However, at the Severance Hospital alone, we had already performed surgeries on 380 patients with congenital heart disease and 150 patients with acquired heart disease by that time. A Korea Times reporter who witnesses the situation expressed the regret in an editorial stating that we were failing to provide adequate care for our children. As a matter of fact, however, the issue was not a lack of ability, but rather a lack of financial resources. In 1984, a nationwide fundraising effort was launched, which led to the creation of the Korea Heart Foundation. During its transition from government-led fundraising to private funding, the project financial backing gradually increased from nearly nothing to a substantial amount of $3 million at present a year. Before having medical insurance, we required $7,000 to $10,000 per person. Presently, we are providing assistance with an average amount of $3,000. The Korea Heart Foundation has been supporting people for almost 40 years, providing a total of $81 million to date to nearly 40,000 individuals. The funds were raised up to $63 million, and the remaining amount was covered by the investment income generated from the initial foundation. From the graph of life expectancy and GDP, it is evident that South Korea has made significant progress compared to all other countries. This is 2021. Since 1990, numerous channels have opened the doors for foreign patients to receive medical treatment in Korea. Our organization has been supporting these patients, and as of 2013, we have assisted over 650 individuals, amounting to a total of $4.3 million in support. As an instance, Severance Hospital performed the surgeries on 5 patients from Mongolia in 2006. We compared the funding of surgery for foreign patients to the training of medical staff in the developing country. There is a saying as, give a man a fish and you feed him for a day. Teach a man to fish and you feed him for a lifetime. Assisting patients ends as a one-time event and it can be expensive. However, by training doctors, we can provide ongoing medical care to patients within their own country. This approach is also cost-effective, as it costs $480,000 for 66 surgeries and $166,000 for training for 10 doctors. From 2008 to 2011, 8 doctors from 4 countries were trained for 1 year: Pakistan, Vietnam, China, and Bangladesh. However, this was requested by individual hospitals, and we didn't know which ones or what their results were after the training. As you know, if you make a good pediatric cardiac program, integrated approach is essential. Pediatric cardiologist, cardiac surgeon, anesthesiologist, perfusionist, and intensivist. And evaluation should be done by outcome data analysis. And also, the partner site should be tertiary, teaching, and center of excellence hospital, but not yet good at cardiac surgery. More importantly, whether they have willingness to commit to the twinning concept. The challenge of cardiac surgery in developing countries include many surgeons trained differently from different countries. Pediatric hospital is separated from adult hospital, so there is no synergy, and nobody has responsibility of the result. The Korea Heart Foundation initiated a group training program that shifts the focus from training individual surgeons to a team approach, recognizing that surgical outcomes can only improve through collaborative efforts. The program has enabled 5 medical staff to undergo 1-year training at a prestigious Korea hospital of their choice. From 2012, there are Shasin Hospital, Mongolia to Severance Hospital, Yanbin University Hospital, China to Samsung Medical Center, Chore Hospital, Ho Chi Minh City, Vietnam to Bucheon Sejong Hospital, NSMRC Pediatric Cardiac Surgery Hospital, Astana, Kazakhstan to Asan Medical Center, Yangin Children's Hospital, Yangon, Myanmar to Severance Hospital, and Ibrahim Cardiac Hospital, Dhaka, Bangladesh to Seoul National University Hospital. As an example, in 2014, each person received a monthly support amount of $1,000, round ticket of air flight, economy, cover health and travelers insurance, experience of Korean traditional culture. Korean traditional wear, hanbok, bow each other, and the tea ceremony. I observed the advantage of team training like this: share food and rooms, go to work all together, question and answer or discussion can be done in their own language. After returning back, they are working as one team in the same manner. The medical staff from the training hospital made annual visit to the site after the team returned to their country. During these visits, they assessed whether additional support was necessary, engaged discussions regarding diagnosis, surgery, and treatment, and provided an additional 9-month doctor months of training, 3 doctors for 3 months or 1 doctor for 9 months. In the world at night, it divides 2 areas: bright North America, dark South America, bright Europe, and dark Africa. Opting for a vertical move instead of horizontal one proved to be an efficient choice, since it helped to save time and prevent jet lag. The Korea Heart Foundation lacks the resources to aid far-off regions like Africa and South America. Considering the challenging situation faced, such as North Korea, Western China, Cambodia, Laos, Bangladesh, and other Central Asian countries. CTS net registered adult cardiac surgeons per million population was published in JTSS 2019. Here has a shortage of heart surgeons, which is indicated by the pale color on the map, as the same as dark at night. Our primary focus is on aiding North Korea. especially the Ongnu Children's Hospital located in Pyongyang. The hospital is currently performed a little number of heart surgeries, and it is Ongnu Children's Hospital. And here is Pyongyang and North Korea. It is only 200 kilometers away from Seoul. Surprisingly, almost 90% of babies born with congenital heart disease live in regions where medical care is inadequate or unavailable. There are many problems to be solved in Asia. I would like to finish my talk with the announcement of Korea Heart Foundation session tomorrow afternoon. Doctors will present their data and discuss it all together. Please welcome. Thank you for your attention.